here we are in 2020, and there is this new factor of coronavirus and COVID-19, and how that impacts things. What are you uh, discussing with your patients who are being booked in for surgery now in terms of what that might mean? And of course, we need to flag for anyone watching this video beyond the summer of 2020 that things may well change.
Yeah, absolutely. Yeah, so it's obviously it's a really important factor at the moment, and we are in this time where we're restarting, to do planned surgery now. We are talking specifically to every patient, about the risks of coronavirus, COVID-19. So, specifically, we tell them that if they have an operation, obviously there's a risk of them getting the virus during their inpatient stay or afterwards, or having it beforehand. So they will have, they'll be instructed in some form of isolation before the operation. The guidance on that is kind of changing. So as you say, relevant to time. So it might be 2 weeks of isolation before surgery, or it might even just be 72 hours for some patients. But there would be some period of isolation beforehand to make sure that they don't have it before the operation. And most patients would get tested for COVID as well before the operation. So that as far as you can do, that they've not got it at the time. And then afterwards, they would also be advised to isolate, for a period after the surgery as well, because we know that if you get it after an operation, it can also be risky. So that's still the actions the patient has to take. They have to take it really seriously and isolate before and afterwards, look after themselves, etc. And that can have quite a lot of impact on someone who's working, for example, that they might be told they've got to have 2 weeks off before the operation as well now, and they weren't expecting that. So it's important. In terms of the risks, that's much harder to sort of put into figures, because there's not a lot of data on it, and it's probably changing as we speak. But in general, the data that we do have probably suggests there's probably around about a 2% chance of getting COVID, by having an operation. And then if you do get it, the risks are obviously, everybody knows what COVID does to people. It can be really bad and can put you in ICU, and people die as a result of that, in some cases. So taking that 2% risk of getting it, if you do get it, there probably maybe around about a 20% chance of dying because of it. So it's quite serious. Having it around an operation time is probably worse than having it at another time. So it's really important to have that kind of conversation. And it's also important to stress to patients that it's very patient specific, as we've already talked about. So the patients that are, that are higher risk are patients who are elderly, patients with comorbidities such as diabetes, overweight, multiple medications, kind of problems such as this, all the normal risk factors that have been talked about in the media are all there. So the risks are different for different patients, but as a broad brushstroke, those are the kind of figures that we're sort of talking about at the moment, as you say, in sort of mid-August 2020. Those are the figures that we're using to talk to patients. And many patients would say, well, the response from patients is very different. Some patients would say, oh, well, I know someone that had it, and I can manage. I'll wait. I really that's the worst thing. I just don't. I just want to switch off from there. I'll wait. I'll just wait and not have my operation. Thanks very much. Other people will say, well, actually, is that going to change? So what I think this is an interesting question. So if I put my operation off for 6 months, what's the risk then going to be? Well, it's probably going to be quite similar. We're seeing that there are some areas where there are second surges. Until we get a vaccine, which is across the whole population, these risks that we've just talked about are probably going to be there or thereabouts for quite a long time to come. And I think that's really important you get that across to patients, because they might think, oh, well, I'll wait for 6 months and then it'll go away and it'll be better. But actually it might not be. So they need to sort of balance this up into the normal risks of thinking about surgery. So I think that's an important factor. And the other thing that people have often brought up to me is, so we're restarting surgery now. You think they kind of quite insightfully saying, yeah, please, I want it now, because I think you're going to have to stop again in the winter. you know, which is possible, which is a possibility.
Yeah.
So sort of taking that opportunity to have their operation when it's available.
Hmm.
But yeah, all these things are changing, you know, quite rapidly, obviously.
Yeah, of course.